Well, welcome everybody. I'm excited to see you. It's again our Wednesday noontime meeting, and looking forward to going over great information about the one thing that's it's really the most important factor you can assess for your own health and ask your doctor to help you with if you have trouble with this area. So welcome. I'm Dr. Geraldine Brossfield. I'm excited to share with you today the one thing that's going to be most important for your health. It affects everything. And I'm going to share a screen that's a PowerPoint. We'll go through that PowerPoint together and then be able to take some questions and answers after the PowerPoint if there's anything that you'd like to talk about more or specifically that we've covered in the talk. So give me just a moment. I'll share my screen and get that PowerPoint up and running. Okay, so we're going to talk about the one thing that impacts everything else in your health, and that is insulin. It's been amazing, and I think for years, many of you have heard me talk about blood sugar. And in reality, when we're managing blood sugar, what we're doing is impacting insulin in our system. There are several other things that also impact insulin, but the way we eat is actually probably the greatest impact on our insulin levels. And I want to share with you why that's so important for your health. I'm going to talk about how stabilizing insulin is really the key to health. You know, it's interesting when I sit and talk with patients about how to lower their cholesterol or how to reduce cancer risk or how to remove the risk or treat diabetes or how to prevent Alzheimer's. Every single one of those disease states has the same key, and that is insulin. So we're going to talk about why that is and how insulin is such a major factor in causing inflammation in our body and how we can adjust that. We're also going to talk about how blood sugar impacts insulin because it's really one of the key factors we have control over to adjust our own insulin, and then methods to stabilize our blood sugar and insulin that we can utilize, you know, as early as this afternoon. Many of you have seen this slide before, and I use it to illustrate a specific point. I want you to notice the blue ups and downs are your blood sugar. And this is a demonstration of what would happen to your blood sugar if you ate meals that were really actually fairly carb heavy. If you just had orange juice for breakfast and then a bagel for a snack, maybe hamburger for lunch. If you continued on that pattern, you're going to have very high rises in the blue line, which is symbolic of your blood sugar. But the other thing I want to point out to you that often gets lost when we look at this slide is the red dotted line, and that's your insulin level. So your insulin level, I'm just going to track it here, is this red dotted line that is a response to your own blood sugar. So if I just have a glass of orange juice and my blood sugar spikes, and realistically, if you're used to blood sugar numbers, your blood sugar number might spike to 194 from a glass of orange juice. Or if you have really excellent insulin responses in your body, maybe it'll be a little lower. But when you have this high spike of insulin, high spike of blood sugar, you'll have a response from your pancreas to push out insulin into your bloodstream because insulin's job is to take this blood sugar and put it away in all the cells of your body as storage. And that's really important because if we leave blood sugar high, it actually is damaging. It will start to cause little clumps of blood sugar in the little tiniest blood vessels of our kidneys or our toes and fingers or eyes and start to cause complications from high blood sugar. So insulin's very efficient. It comes out and you see this nice rise right here of insulin in response to your glass of orange juice. And then your blood sugar crashes and insulin will drop and come back down until the next time you eat. And then in response to the next time you eat, insulin will rise again. So in this case, this picture shows us a clue to inflammation in our system, and that is this high insulin level. If insulin level stays high all the time, we've created the perfect storm for inflammation in our body. Inflammation is another way to say the first step of most disease. But really the cause of inflammation is extremely connected to, and in fact impacted most by, our blood sugar and insulin levels. So inflammation, we know of, I often have said in lectures that inflammation is kind of the first domino in a domino effect of disease. And the cause of inflammation is tied to our insulin sensitivity and our insulin levels in our body. So one question I often am asked, what do I mean when I say insulin sensitivity? Well, insulin really is created in our body in response to this blood sugar. But one of the things that happens that really is the term insulin sensitivity is if I have just eaten horribly my whole life, and let's say this pattern on this slide is what I've done day after day after day, the cells in my body that insulin has gone to and knocked on the door to put the blood sugar away, those cells start to say, we've heard this before, we're full. So it's literally like there's no room at the inn. Insulin goes up to a cell, it wants to put sugar into, let's say, a muscle cell or a fat cell, and that cell is full. It doesn't have any more room. And so insulin comes up to the cell, it tries to fit into a little receptor. It's kind of like a lock and key. It fits into that receptor and tries to open the door in order to let the blood sugar go into the cell for storage. And that cell throws up its hands and goes, no way, I've changed this receptor. And in fact, I'm not even going to have as many receptors because I don't need any more. I have no more room for storage. The storage bin is full. And so insulin then goes and knocks on the next cell door, and the same thing happens. And it goes and knocks on the next cell door, and literally it can't find anywhere to put the blood sugar away. That's called insulin desensitization. So when you have insulin sensitivity, you actually have cells that still open the doors for storage of sugar. When you have insulin resistance or insulin desensitization, you have cells that say, no more, I don't want anything stored in me, I am full, and I can't let you put any more sugar in these cells. Typically, if that insulin rises, because now it's literally having to sort of strong arm the cells, it's like, okay, gosh, I'm not finding any open motel rooms or any open doors. I'm going to have to go with a bigger force. It's kind of like taking a door-to-door force to say, well, are we going to find anywhere to put this blood sugar? And so insulin rises in our body. And literally one of the tests that I do in every patient is a fasting insulin level. And tip number one from our talk today is that if there's one test you ask your doctor for, it should be a fasting insulin level. Looking at that insulin level gives you the clue as to whether or not you're insulin resistant or insulin sensitive. Ideally, that insulin level would be below 10. In most of us, it's between 10 and 25, and it's called normal, up to 25. But if it's between 10 and 25, you can't lose weight, you have high inflammation, and you have a setup for autoimmune disorders. So that insulin response curve is really important because it tells us if your blood sugar management is working and your body is still receptive to storing the extra food that you eat. And guess what? We can adjust the way we eat. And so we can adjust the way the insulin responds by our methodology around eating and controlling our blood sugar. Insulin is kind of like a switch. And, you know, I think in my grandparents' days for sure, and even in my parents' days, there was a lot more rail travel. People used trains a lot. And any of you that have either played with trains or had a toy train, or seen train yards, know that there's sort of these great big switching sections of the train yard where a train can come in, and now instead of going towards Philadelphia, you want it to go towards New York. And so literally they switch the train tracks, and the train now has a clear path to go to a different city. Well, insulin is kind of like that switch in the body. I think of it like a major junction switch. And here's the deal. If we have low insulin levels consistently, we burn fat. If we have high insulin levels consistently, we burn carbs or sugar. And what we do with fat is we store it. And we set up the very first step towards inflammation and disease. So whether we run with high levels of insulin, which we would think of as being insulin resistant, because the body raises the insulin level and makes a high insulin level in order to sort of overcome the resistance of the cells and to find a place to store our sugar that we've eaten. Whether we're on that end of the spectrum or the low end of insulin levels, where we're burning fat and can store excess because there's still room in the storage system. Whichever end of that spectrum we're on really is the determinant for whether or not we're going to develop an autoimmune disorder or an environment that is more prone to mutations that cause cancer, or develop Alzheimer's disease, or develop diabetes, or deposit cholesterol, as in plaque in our arteries. So this switch is a really important thing to understand. And so I'm going to spend the rest of our time talking about what impacts insulin levels, because in a perfect world, if I could just, if I had my magic wand right here, what I would do is wipe it, raise my magic wand and say, let's all have low, consistent insulin levels. The trick becomes, how do we do that? Because we're bombarded with information on how we ought to eat or what we ought to do with our insulin or what medicine we ought to take, and it gets confusing. So in our body, we store energy in different compartments. So in our bloodstream, we have blood sugar. We've all been used to having our blood sugar checked. And in essence, we have about 10 minutes of blood sugar if we were under great stress that we could manage. If we were under low stress, we could manage for 20 minutes with our blood sugar, just being the only thing that would sustain our brain function and our body function. If we look at glycogen, that's a storage form of sugar, and it gets stored in our liver and muscle. And that actually gives us a lot longer. That gives us more like 3 to 6 days of time where we have glycogen stored in our muscle and our body. That really is what happens when, let's say, let's go back to cave time, but let's say we were in the olden days where we really had to hunt for our food, and maybe we had a big surge of food on a day when there had been an animal, when someone shot a deer, for instance, and was eating or feeding a group with that one kill. But if you think about it, there might then have been many days where all you could find in a forest would be to forage leaves and berries and not have very much food. So you needed, I think evolutionarily, the body needed to have at least several days of food in case you didn't find food immediately. And then in our body, we have this amazing storage system of fat where we have literally 15,000 calories worth of fat stored in our body, which in a low stress situation would sustain us for 94 days of time. So when you see people that say, gosh, the only problem with that person is they're eating way too much, you have to realize that it would take starving for 47 to 94 days to really deplete the fat stores in the body. So we have a really robust storage system of fat in our system. So if we were going to look at how we would lower the insulin levels and how we would sensitize our body so that we were very insulin sensitive and we had no risk because of high insulin, this is one methodology, and that is to eat what we call low glycemic index foods. And so there's been a lot of work really since 1980. This concept came into vogue, and a lot of research showed that small frequent meals allowed us to maintain a lower insulin level. And the way that this works is small is the operative word. So these little meals are about 100 calories. We really can't put away and store more than 500 calories at a time. And if we're trying to keep insulin levels really low, like close to a baseline normal level, these meals have to be quite small. And so for many years, and I still, for many patients, will use a system where I ask them to eat 100 calories that are balanced in protein and carbohydrates and fiber every 3 hours in a small, frequent feeding fashion. And that keeps the insulin level at this nice, steady, low baseline. And that allows them to burn fat. And that also, in turn, then lowers inflammation because of that nice, low insulin level. So the issue with that pattern of eating, though, is that people still need to be really aware of balancing their carbohydrates and fat and protein. This slide, and you're going to see some more sort of in this style from here on out, green is when you're in fat burning, and red is when you're in fat storage. So red correlates with high insulin and green with low insulin. So if this is just a comparison of how different foods impact our system, you can see that fat has very minimal impact on raising your insulin. So that's one of the reasons that I think one of the greatest little inventions at Trader Joe's is the little packages of olives. I don't know if you've seen them, but there's these little packages of olives that have maybe 8 olives in them, and they're great. And they're awesome because if I have that as a snack mid-morning, they're really basically fat and a fairly low calorie snack that's not going to raise my insulin very much if I have that for a snack. Protein raises our insulin a little bit more, but still about half of a carbohydrate's impact on our system. So the real trouble with raising insulin tends to be in the realm of carbohydrates, and that's why we've all heard of low-carb diets and low-starch diets and avoiding the white foods, because they tend to be the carbohydrates that are very simple to get into our bloodstream and raise our insulin. So knowing this information can help us in the choices of what foods we eat. And if a person is going to eat in a pattern where they're eating, a small snack 5 or 6 times a day, they really have to choose to stay within a balance of mainly fat and protein and a small amount of carbohydrates in those little 100-calorie snacks each throughout the day. And then they can have one meal that's a little larger, where maybe you have a plate full where 3/4 of the plate are vegetables and healthy fruits and veggies, and then 1/4 of the plate would be protein, and that works well. If we look at one of the things to just bring home, and I think we all, in some ways, I feel like I'm a broken record when I talk about sugar intake, but until we get the message, I think it bears repeating, and that's just that sugar is an enemy. Our risk of type 2 diabetes doubles if we have 2 sweetened drinks each day. So this is just to give you a framework. Even if the sweetened drink was a naked juice, which a lot of us have thought of as a healthy drink, or even if it's a pure fruit juice or a Gatorade, those are drinks that have sweetener in them. They have sugar in them. And 2 of those drinks a day literally doubles our risk of diabetes. So when we look at sugar and starches, we know that flour-based foods and sweetened drinks, for instance, are really the top 2 culprits in our society. Those are our top 2 culprits of ways that we tend to take in excess carbohydrates that spike our insulin levels. There's a lot of other things that impact our insulin levels as well. In this slide, you can see things on the top that increase insulin and things on the bottom that decrease insulin. So a high carbohydrate diet that has sugary drinks or flour-based foods, high caloric intake, frequent meals and snacking, and I think that's very true, particularly if the size of the meal is large. So if it's 100 calories, we have a benefit of barely impacting the insulin, whereas a larger meal has a much more dramatic impact on insulin. Sedentary life and empty calories are all things that insulin goes up if we have those in our intake and patterns. Decreasing insulin really depends on eating either a lower calorie intake overall, a lower carbohydrate content, or having intermittent fasting, which I'm going to talk about a little bit more, and foods that are high nutrient density. So the difference between a high nutrient density food and a low nutrient density food, a good example might be a potato chip versus, I'll say, broccoli. If I eat broccoli, I get lots and lots of nutrients from that broccoli at a very low caloric count. Whereas if I eat potato chips, I get very few nutrients at a very high caloric count. So that's an empty calorie if I eat potato chips versus a high nutrient density food would be like a vegetable like broccoli, or even a protein would count in that as well. So one of the questions that has really risen as the research has been advancing over the last several years is there some way that we can even make eating healthy work better? Because we've had a lot of information, at least in the research side. I'm not saying that all of America has embraced this. And I will tell you, all of you on this call, I know actually have been trying to eat healthy. And so what I will say is, even with all the knowledge we have about eating healthy protein and lots of fruits and vegetables, we all are still looking for how to do it better and how to improve our health. And so one of the things that I've watched as the research keeps looking for more information is it's been information about insulin that keeps advancing and giving us some more tools in our tool belt. So this slide gives us a clue about something we can do in addition to smaller meals and balanced meals that really have low carbohydrate content. Insulin will drop. Like if I have a meal, and even if it's a healthy meal, my insulin goes up, it'll start to come down at about 3 hours after that meal. And you can see that at the top of this curve. This is it's starting to come down. And so by 3 hours after that meal, my insulin has come down quite significantly. But one of the things that's been really a unique additional finding that over the last 5 to 6 years has had a lot more research done in its regard is that if we stop eating for 10 hours or more, there's another big drop in our insulin levels. So on one hand, the concept of small frequent meals utilizes a couple things. It utilizes the concept of small amounts to bump our insulin level up and keep our blood sugar steady. And it also utilizes the information that our blood sugar drops and our insulin goes down after about 3 hours from when we ate. But this additional information about a drop about 10 hours after we eat is something we can leverage as a different tool. And a lot of people will say to me, is there one, what's the way I ought to eat? Should I do paleo? Should I be a vegan? Should I do intermittent fasting? Should I have small frequent meals? And I will tell you, there is not one size fits all in an answer. There are many people who need to eat 5 to 6 small meals a day because that actually is what stabilizes their system the best. And honestly is practical for them as well. There are other people that can do intermittent fasting and do really well with that and gain huge benefit from it. But there are some people with intermittent fasting who have a really difficult time in that transition. And the people that most commonly is tough for are people with adrenal burnout. So I really carefully choose the pattern of what I'm guiding people in how they should eat based on the rest of their system, based on whether they have a propensity to store fat, which some of us genetically do and can't do, for instance, a ketogenic diet because we'll store the high fat, and other people who need, for instance, not to do intermittent fasting right now because it would tank their adrenal glands more. So we end up picking between these different methodologies based on the rest of your health pattern. This is a common insulin pattern in a person who's eating smaller meals with snacks between. And what's modifiable in this pattern is how big the meal bump would be. So if I eat a bigger meal, I'll have a bigger bump in my insulin. And so what I've chosen to do in the way I eat is personally to try and keep these bumps with my meals quite small. And you'll notice that if you eat smaller meals, over time, you won't be able to eat bigger meals. Like you'll actually have a smaller stomach. We used to talk about our stomach shrinking. We just get used to and have turnoff switches that happen sooner when we get used to smaller meals. So if I was going to give you a list of how to lower insulin, this is really the basics. And then I'm going to go into 3 methods that do that in diet patterning that will help us maybe identify something that you could consider using for yourself. And then you could seek guidance if you have more information you need in order to make that decision. So you want to eat to keep blood sugar stable. So some of the methods I've mentioned already that make that happen are smaller meals and less simple carbohydrates. So essentially the components that you want to make almost all of your diet to be made up of are plants and protein. And everybody will vary that differently. A person who's trying to eat more of a vegetarian lifestyle will choose protein sources that are different than a person doing paleo. But plants and protein are really the backbone of what we as human beings should eat. They are the foods that promote health in our system. And probably because of convenience food and our fast lifestyle, processed carbohydrates have probably been the biggest shift in our diets if you look at 100 years ago versus now. We're all on the run. We're trying to eat in a quick fashion. We don't pause to chew our food enough. We don't pause to enjoy our meal and be mindful when we're eating. And I'm guilty of this. I had a protein shake in the car this morning. We often eat in the car. We often eat on the run. And many times, unless we're really mindful of it, those meals on the run are processed carbohydrates. They're the easiest thing to grab. And they tend to work with, if you've listened and will do in the future, a talk about how sugar affects the brain. Carbohydrates tend to feed the craving cycle of our brain and sit on the same receptors in our brain as basically opioids or cocaine. So carbohydrates are addictive and set up a cycle where we want more of them. So avoiding those actually is one of the key factors in keeping our insulin steady and our body sensitive to insulin's effects. I'm going to highlight briefly these 3 methods of how we eat because people always want to know the how-to, and I'm going to suggest you need more help potentially, or more information than obviously we could cover in this webinar about how to eat. But these are 3 methods that all work to keep blood sugar stable and lower insulin. One of those is small meals or snacks every 3 hours. And like I said, generally start to think of that as a framework of 100 calories every 3 hours with about 10 grams of protein each time you eat. And then one time during the day, you can have a little larger meal where maybe you have a bigger serving of protein and lots of vegetables. So that's one method that will lower insulin and stabilize blood sugar. And I have many patients who have been able to get off of their diabetic medications, lower their arthritic pain, and find like they're more mentally clear when they follow that pattern. The keto diet we hear about a lot these days is a high-fat diet where fat intake is about 65% of a person's total calories, and their carbohydrate intake is very low. There's some debate whether it ought to be below 30 or below 50, but certainly below 50 and with high fat. The key to that diet is you can't just switch on off and on with that diet. I can't just go, I'm going to be on a keto diet these 5 days, and then this weekend I'm going to go party on with ice cream. It doesn't work that way. You have to be consistent. And so in some ways, my pounding home that needs to be consistent is one of the things that sometimes discourages people about this diet, because I say, you know what, if you're on the small meal and snacks every 3 hour plan, you could have a tiny bit of ice cream as long as you balance it with some protein, for instance. Whereas on the keto diet, you're going to knock yourself out of ketosis if you have toast or ice cream or any of the carbohydrates. The carbohydrate total at 50 grams or so or less really is not a lot. Like if you're eating vegetables, you're gonna get to your 30 grams in a day. And just to give you a sad commentary, you know that I'm vegetarian, I think, on this, those of you that are on this webinar. And if you go to Trader Joe's and pick up, for instance, the vegetarian pad thai, it's like 64 grams of carbohydrate in that one serving. And so keto doesn't work well with anything that has any processed carbohydrates whatsoever. Intermittent fasting is a newer kid on the block, so to speak. It's gotten quite popular. And in some ways, people have said to me, is it a fad or is it something that's just going to come and, you know, is it safe and is it good? And I will say it has a lot of really good science behind it. We're seeing intermittent fasting as a key to increasing longevity and decreasing inflammation and insulin in the body. And so I'm going to talk a little bit more about that one because it's one where there's a lot of questions. The other two, the small meals and snacks every 3 hours and the keto, I think we've all been a little more familiar with over time because they've been around a little longer. One of the reasons intermittent fasting has gotten a lot of play or really a lot more looks in the literature is that it actually does reduce insulin more effectively than other methods. So if you look at a low-carb diet, which is the bar in the middle right here, the one that's labeled B, this is a carbohydrate-free or really low-carb diet, and that'll reduce our insulin level 50% as compared to a standard diet. And realize a standard diet is pretty awful. You know, a standard American diet is not healthy in the least and would typically have a grain at almost every meal of the day. So if we go to a low-carb diet, that one change reduces our insulin about 50%. From a typical American diet. But notice that in column C over here, fasting reduces it almost another 50% more than a low-carb diet would. So if I was going to look at this slide and just say which method is most effective, I would pick fasting. It's pretty clear. It's the one that reduces insulin the most. It's a little bit more tricky, but there's a couple ways that you can start using the principles of fasting and even go to something that we call a limited eating window as a type of intermittent fasting that can help you, and you can combine B and C. So what this slide and this study doesn't show is what if we combine these two? What if we take the benefits of fasting and still eat fairly low carb? Could we really actually have the best of both worlds? So if we go back to what I think most of us were raised with, where we were told that eating 3 meals a day was really kind of the way we ought to eat, you can notice that the red in this slide is time where insulin is high. And granted, if I ate 3 really small meals, the insulin curve would be just a littler bump, right? So we could lower insulin just by eating smaller meals and doing some calorie restriction. But if we go on and say, well, what if instead of doing the typical 3-meal-a-day pattern, what if instead I basically went to a 2, and you could even have a snack in between here and you'd have another little red bump of a little more insulin. But what if we went to a pattern where we did all of our eating in an 8-hour window of time? So what this might look like, if this is your day, and let's say that this is midnight right here at this left bar, where the black line is up and down. If that's midnight and you sleep from midnight until the morning, and maybe you don't start eating until lunchtime, so maybe your first meal is at noon or 11 o'clock in the day, and then you let yourself do your eating in the next 8 hours so that by 7 or 8 p.m., you have finished eating. You've then set up a scenario where you have a lot more of your day in what we call fat burning, or insulin levels can stay even extra low. So this concept, this limited eating window where people eat for 8 hours of a day, is it's really the most easy to implement of the intermittent fasting options. Intermittent fasting means lots of things. Some people are doing a 5 and 2, where they have 2 days that they really restrict their food or do a water fast, and then 5 days where they eat reasonable food, but really without restriction. Other people do 5 days a month and 25 days of regular eating. I am finding with my patients that this method, the 8-hour eating window, is the simplest for us to implement. Most of us sleep, during the night. And so if you imagine skipping breakfast, which is the opposite of the small frequent meal pattern, where we've talked about being consistent with small amounts, in this pattern, you literally eat for just an 8-hour window of the day. And what I tell people to do in moving towards this is to notice what your pattern is right now. So if normally, when I started doing this, I would eat a breakfast around 7 and I would finish my dinner at night by 7 or 8 p.m. So I typically started out looking at this when I was having a 12-hour eating window and 12 hours of not eating. And so what I started doing was just bumping the edges of that. And I moved to an 11-hour eating window, and then a 10-hour eating window the next week, and then an 8-hour eating window. And for most people, this isn't too bad. It's not too hard to do. If you're doing this, what you want to be sure you do in this time when you're not eating, so let's say that this is between 8 and 12 in the morning when you're not eating, you can have all the water that you want. You can have any non-caloric drinks. So black coffee, black tea, herb tea, and water are all things you could drink, really to sort of stave off hunger as you're making this transition. In choosing the foods that you eat during that eating window, it still really makes your results the most achievable and the best if you minimize empty calories or bad food, if we want to put it that way. Basically, even though on this particular dietary pattern, you can have a little bit of carbohydrate, you're going to have even better results if you keep your carbohydrate counts low or on the lower side in your eating window. It really seems like whether you're using intermittent fasting or a small frequent meal pattern, and certainly if you're doing a keto pattern, starches are the key to success or failure. If you have starches in your diet, you're really going to have to balance them and not overeat starches if you're doing the small frequent feeding, or if you're doing the intermittent fasting, you'll have more success if you keep your starches to a minimum. There are a number of things that are beneficial in eating whole food, and those are fiber and fat in particular that really help us not spike our insulin. I call those the brakes. They help us make the intake of food and blood sugar much slower, which helps us not spike insulin. So does slowing down when we eat. That'll also help us keep our blood sugar a little bit more steady. And in essence, if we wait about 20 minutes before we have seconds or before we eat more after maybe our first round of our plate or our food, we'll end up usually allowing our body to have time to signal us that we're full and we don't need to eat more. In addition, if you can eat food in its most whole form, the least processed, the least blended, the least mashed that the food is, the longer it takes to digest, and that actually stabilizes blood sugar and insulin. And also having protein virtually every time you eat helps you stabilize insulin and stabilize blood sugar. So once again, you've seen this slide just a couple slides ago. Just to remember, if you're working on lowering insulin, your goal is to keep your blood sugar stable by eating mostly plants and protein and avoiding processed carbohydrates. Then you want to pick a method and go with that playbook. If you're doing the small frequent meals, go with that playbook and become an expert at that. If you're doing keto, go with it and learn how to do that the best. And the same with intermittent fasting. And the nice thing is that intermittent fasting can be coupled or merged with either of the other two programs, so that you could do intermittent fasting along with the keto diet or along with the small frequent meals in a low glycemic diet. So the one other thing I want to leave you with, and I mentioned it earlier, is that if you're going to do one test or ask for your doctor to do one additional thing that would help you know about your own insulin levels and your own propensity to develop inflammation, it would be to ask your doctor to do a fasting insulin level. I've put our phone number here also, so that if you don't have my office phone number, it's at the bottom of the screen, 760-573-2761. We're a membership practice, and what we do is we work with you to do testing so that we can know the safest method for you to lower your insulin and stabilize your blood sugar, and then help support you with doing that through the rest of a year's membership. Thank you for joining us for the webinar today. I'm going to sign off, but I just appreciate you being there. Those of you that are live on the webinar right now, I'll go ahead and switch over for a question and answer session.